This is the fetal skull, which is made up of three types of bones. One is the cranial bones, which form the cranium or the vault. Another is the facial bones, which forms the face. And our next one is the base. Now, this fetal skull forms anteriorly with two frontal bones, and at the midpoint of the frontal bones, there is ossification center of the frontal bones, and which is known as frontal eminence. And then posteriorly to the frontal bone, there is two parietal bones, and in the midpoint, there is ossification center for the parietal bones, and which is termed as parietal eminence. Posterior to the parietal bone, there is located one occipital bone, and laterally, there is two flat bones termed as temporal bones. And now, sutures. In between the two frontal bones, there is frontal suture. In between frontal and parietal bone, there is coronal suture. In between two parietal bones, there is sagittal suture. In between parietal and occipital bone, there is lomboidal suture. In between parietal and temporal bone, there is squamous suture. Now, the fontanelle. There are mainly 6 types of fontanelles, but in obstetrics, there is 2 types of fontanelle, which is having clinical significance. One is the anterior fontanelle, which is of kite shape or diamond shape, known as brachma. Posteriorly to this anterior fontanelle lies the posterior fontanelle, which is of lambdoid shape or trigonal shape, or in Greek letter lambda shape, and this is termed as posterior fontanelle or lambda. And this anterior fontanelle closes at 1.5 years of age of fetal of baby, and this lambda closes 5 months of age. Now, when the baby comes out, there is 3 types of presentation. One is vortex presentation, which is made up of the smallest diameter of the fetal head, and another one is the brow presentation, which starts from the orbital ridges or from the glabella till the starting of the anterior fontanelle. Another one is the face presentation or the mentum presentation. Now, about the diameters. That first, the mnemonic is sauce, send, SMS, please transfer some money. So, at first, sauce, which denotes occipital region. So, from the suboccipital, then suboccipital-bregmatic. Suboccipital-bregmatic is the smallest diameter, and this is about 1.5 centimeter. Suboccipital, then frontal. Frontal is where the anterior fontanelle ends. Suboccipital-pragmatic is about 10 centimeter, and then occipital-frontal. This is about 11.5 centimeter, and this starts from the occiput to the glabella. This is about 11.5 centimeter. Now, I am coming towards the SMS. SMS means it will start from mentum. So at first mentum vertical. So from mentum to the vertex. This is the largest diameter, and it is about 14 centimeter. And submentum means below the mentum. Submentum vertex. This is about 11.5 centimeter. And now submentum brachmatic. This is about 0.5. About 9.5 centimeter. Now comes the diameter between two parietal eminence, known as biparietal diameter. It is about 9.5 centimeter. Then is the bitemporal diameter, which starts from the end of the coronal suture. This is the bitemporal diameter, which is 8 centimeter. And then bimastoid diameter, this is 7.5 centimeter. And super subparietal, which is above of one parietal eminence and below of another parietal eminence. This is about super subparietal 8.5 centimeter.